Hello, participants. Welcome to a workshop on diabetes awareness, management, and prevention organized by NetLife Africa. I'm your host, a health educator working with NetLife Africa. My name is Sunday Udofia. Before we proceed, I want to let you understand what is known as diabetes. Diabetes is a group of disease that is caused by too much sugar in the blood. It happens when your body system kills and destroys a fluid that's supposed to help reduce sugar level, and this fluid is called insulin. There are other things that can cause diabetes. For example, maybe your environment is being infected by a virus that triggers diabetes. Diabetes can also be inherited from the family because of what is called genes or family history of diabetes. Physical inactivity, heavy consumption of alcohol, social class, as well as old age also do contribute to diabetes. Most people may have what is known as type 1 and type 2 diabetes. For us to be able to understand why is it type 1 and why is it type 2, we have to know the major or the main symptoms of type 1 diabetes and also type 2 diabetes. So what we want to look at now is the three big symptoms of type 1 diabetes. Number one is constant thirst. When you are thirsty all the time, you feel like drinking water and your throat is always very dry. That is what is known as constant thirst. It's number one big symptom. Then the second one is frequent urination. You use your bathroom or your toilet oftentimes and you want to urinate oftentimes, and that's another second one. And the third one is rapid weight loss. You see someone, the person is losing weight rapidly. It might be your brother, it might be your sister, it might be someone around your environment, and you notice that it is good that if it's your loved ones, you approach the person and try to counsel the person, because this is a symptom of type 1 diabetes. Now, when you consider children, let's say, how can you know that it also affects children? You see a child that is always feeling very tired and weak. Oftentimes, we call that fatigue, and it cannot see very well. We'll tell you, Mommy, Daddy, I cannot see that object very well. It's having a blood vision, and also you experience a rapid weight loss within the child, and frequent urination also. The child uses convenience bathroom all the time, and you have to suspect that this child needs to be screened or get tested, because these are the symptoms of type 1 diabetes. We know that even though we have type 1 diabetes too, as I mentioned earlier, we also have what is known as type 2. Then type 2 also have its own symptoms that when we look at it, it's in a way similar, but sometimes it looks opposite. Number one here, in type 2, you see someone becoming overweight. And we know that when the body mass index is above 30, we now regard that person as being obese. So that means obesity is there. Then we look at someone who seldomly have physical activities. That means less or little physical activity. And also the family history. If your daddy, your mommy were also suffering from this or are still suffering from this, so it is likely that in future times, maybe at certain stage, that you too might likely develop type 2 diabetes. And if we also look at our lifestyles, I would say that people who are fond of, who live a sedentary lifestyle too and overweight, they have a family history of this disease called diabetes. They have high blood pressure and they eat high cholesterol food. These are also things that could cause type 2 diabetes. These are the symptoms when you see this, and you get to run to go and get tested or get screened. We will also look at the risk factors, treatment, and prevention of diabetes. First of all, we want to consider the type 1 diabetes. Typically, it is associated with children to young adults, and the risk factor, like we mentioned earlier, is just generic or environmental factors. If you ask me if it can be treated, I would say yes, that can be done with insulin. Is it preventable? I would say no, it's not preventable. Then if you ask me in case of other cases, other disease cases, could this be a leading factor or part of it? I would say yes, it accounts for 5% of all cases that we have in terms of diseases available in the body. We look at also, let's consider type 2, the risk factors, treatment, and prevention of type 2 diabetes. This one is typically associated with adults from the onset. And the risk factors, like I mentioned earlier, obesity, old age, family of having that history of diabetes. Then the treatment here is with insulin. Is it preventable? Yes. The good news is type 2 is preventable. It accounts for 90 to 95% of all cases. And there is one that we are not familiar, but as a health educator, I have to enlighten you and let you know this. There is what is known as gestational diabetes affecting pregnant women. It is treated. With diets, and exercises are also recommended. And the most important drug or vaccine we will look at is insulin. Insulin plays a very vital role for treatment of gestational diabetes. It is preventable, and it also accounts for up to 9 pregnant women cases. When you have a certain case within 20 or 15, you will see 9 pregnant women cases that is of gestational diabetes. Let's look at the global statistics on diabetes, and we will also narrow it down to Nigerian statistics, and we try to weigh the urban and rural statistics. How is this affecting the population? My brothers and sisters in Nigeria, from the research, it was seen that in 2019, a total number of 463 million people are infected with the disease, rising to 10.2% of people in the world. The disease affects a lot of people in town areas with about 10.8% than people living in rural areas with 7.2%. The sad news is that diabetes have killed about 230,000 each year. You can experience each year diabetes killing 230,000 people in the world. This is very sad. This is very sad. I must confess. Nigeria as a nation in Africa is also having this disease problem. Our country, Nigeria, have the highest number of people suffering from diabetes in this region of Africa. The number is about 3.9 million people between the ages of 20 to 70 years, making it a total of 4.9% of the Nigerian population. We really need to look into this. This is very, very vital, because we can't allow it go down this way. It might not be well in the future. So we need to contact that and help ourselves to continue in these preventive measures and change our lifestyle towards this. Let's consider prevention, management, and treatment. The good news is that diabetes is treatable, it is manageable, and it can be stopped when you notice the symptoms, the earlier symptoms, especially type 2. It could be preventable. There are programs put in place to help you. Then you can receive medical advice, you get tested and screened to know your status, especially when you see those symptoms around you at that initial state. And you can get vaccination around any primary health care center. You can get treatment, get medication at cheaper price. Please know your status today. You can prevent diabetes by doing the following. Just eat healthy food, healthy diet, involved in lots of physical exercises such as aerobic exercises, walking, jogging, playing football, basketball, table tennis, volleyball, skating, and so on. This will help reduce the sugar level in your blood and makes you look healthy. Don't drink much alcohol, please. Please don't drink much alcohol. Stop smoking, because all these are the risk factors when we talk about diabetes. These make those things happen. You have to stop it now to live healthy and live longer. For more information on diabetes, for those of us who want to know deeply, you can kindly contact me through the following. My phone number is +234 8064272523, or you can email me Sunday Udofia 66@yahoo.com. As well, you can visit my website sundayudofia66.wixsite.com/publichealth.gov. Thank you very much for being a part of this wonderful and great workshop. Thank you for coming, and God bless you till we see you next time.